celebration of a monumental milestone in the field of oncology. It's with great pride and immense humility, both at once, that we announce the successful completion of the first robotic-assisted nipple-sparing mastectomy done in Karnataka, performed by legendary Dr. Jayanti Tumsi.
Yes, we have achieved a milestone, but the credit goes to the entire team. It is not one person's job to treat any patient, maybe breast cancer or any other kind of cancer. For sure, the entire team is here who has been a part of this journey of ours, and I'm very happy to share what is it that we have achieved. So to begin with, we know that the incidence of breast cancer in India is on a rise. It is estimated that 1 in 29 women in India has a lifetime risk of developing this disease. And what is most disturbing in India is that about 48% of women who develop breast cancer are young and they are less than 50 years of age. About 4% of them are just 20 to 30 years. About 6% of them are in the age group of 30 to 40 years, and 28% of them are in the age group of 40 to 50 years. Improved technology, better diagnosis, newer medications, these have helped us cure more and more breast cancer patients. So we need to remember that breast cancer is not only a scientific issue, but it also has a social impact on the women, and it raises concern not only of survival but also of femininity, body image and sexuality. The survival rates are high and a woman develops breast cancer at a young age. So not only should she survive, but she also should have a good quality of life. And hence, in the past 3 decades, there has been a remarkable advancement, especially in the surgical approach to breast cancer, where breast conservation surgery has replaced mastectomy and oncoplastic surgeries can be done for larger tumors. But in some cases, mastectomy is inevitable. After all, we want to save lives and to not affect the cancer clearance. Mastectomy or complete removal of the breast certainly needs to be done in certain cases. In such cases, what are the alternatives? We can do skin sparing or nipple areola sparing mastectomies along with primary reconstruction of the breast. Reconstruction of the breast can be of 2 types, that is autologous using the patient's own tissue, or it can be implant placed. These advances that we are using are incorporated into practice after high quality scientific evidence which has demonstrated a very good survival rate, and the local recurrence rates are as comparable to other standard surgical procedures. Now, robotic assisted nipple sparing mastectomy is the newest addition to the entire armamentarium of the surgical techniques for patients who need mastectomy. Me and Dr. Vishwanath together, we treated this patient. She had a lump in the breast which was cancerous, and along with that lump, she had many tiny lumps in all the quadrants of her breast. So all parts of her breast, she had tiny lumps along with one major lump. And she had a very aggressive kind of a breast cancer which is called as triple negative breast cancer. Hence, we decided to give her chemotherapy first, what is called as neoadjuvant chemotherapy. Dr. Vishwanath has given her immunotherapy and chemotherapy, and after completion of chemotherapy, she was ready for surgery. Yes, the discussion was what would be the kind of surgery. She had to undergo a mastectomy. Traditionally, we would just remove the whole breast and leave a flat chest, or do some other kind of reconstruction with a very large incision. but we offered to do a robotic nipple-sparing mastectomy with reconstruction for her. It has been 2 weeks now and her wound has completely healed. Along with the breast lump, she had a swelling on the forehead which also was removed. And today, we just saw her yesterday in the OPD, her wound has completely healed and now she is ready for the next therapy, that is radiation therapy, which will be started a week from now.
An oncologist is definitely at its forefront, and being a medical oncologist, there's so much which is changing in oncology, and we have to be abreast with all this latest stuff which is happening in the world. And we have so many other things like nanobots and nanoparticles of drug delivery, where there's precision oncology, delivering the right drug to the right patient with least possible side effects. That is what we're doing in 2024. Not only that, Dr. Govindarajan's domain. So now we have something called where robotics is helping us to navigate and get image-guided biopsies with precision, that amount of accuracy, using PET-CT and using robotics to help us navigate and get the best possible diagnosis. And even in medical oncology, robotics integrated with genomic profiling, we are able to do what is called as personalized medicine, develop the right drugs for the right patient and deliver it at the right dose. And of course, Dr. Jayanti's domain, surgeons are, by using this robotic surgery, she's actually the first lady surgeon trained in robotic breast surgery. This is one step in this direction, and to get the maximum possible outcomes, precision outcomes, and with least invasion, patients are able to spend that much amount of, less amount of time in the hospital, early wound recovery, and we are able to deliver our systemic chemotherapy with, at ease. And overall, though the initial, maybe we might think that there's some amount of cost which is involved, but over a period of time that gets offset. And every patient, most of our patients have to go through the gamut of chemotherapy, surgery, radiation. So the cost overall, overall it's quite economical when we look at it, and because the patient spends less amount of time in the hospital and the wound recovery is much better. And not only that, psychological outcomes are better. The patient's physical and sexual well-being is maintained. So overall, I would like to commend our surgeon, Dr. Jayanti, for having come up with this fantastic approach and delivering this in 3 of our patients, and I'm sure many more are to come. And for coming up with these kind of innovative approaches, Mr. Dinesh, we recently had this artificial intelligence in our precision oncology centers. All the innovations, and now the minimal access surgery, robotic surgery is one step in the direction. I'm sure there are many more to come, and I would like to congratulate Mr. Dinesh.
So before coming to here, I got consulted with 2 doctors, and I am not satisfied there. So I came to Dr. Jayanti. So she asked me to do biopsy and MRI scanning. With that, I came to know like it is precancerous. So the doctor asked me to do robotic surgery. So I was little worried, but the surgery went well. So it is like removal of the breast and implant and reconstruction of the breast. And my operation was done in the last Friday. So the brain is connected now. Now I'm fine. So in few days I will be again back to my work, my life. Thanks.
First and foremost, thank you for the opportunity. It is a privilege to partner with Dr. Jayanti, Mr. Dinesh, Dr. Naveen, and larger Appolo team to do some path-breaking work in the field of breast oncosurgery. My next 10 minutes or so is going to talk more about the company and the technology that's supporting Dr. Jayanti and the larger Appolo team. At Intuitive, our mission is we believe that minimally invasive care is life-enhancing care. As we heard from the patient, she's going to go back to her regular life after just getting operated last week. That's what we believe in. We want to provide life-enhancing care. It is through ingenuity and intelligent technology. We want to expand the potential of physicians to heal without any constraints. We are a 27-year-old company. So far, we've launched 5 generations of Da Vinci in the world. In India, we've launched Da Vinci 4, on which this procedure was performed. So far, till date, more than 14 million procedures have been performed on Da Vinci surgery, Da Vinci systems. Every 14 seconds, a Da Vinci procedure starts globally, which means through the course of my presentation, more than 40 procedures would have started across the globe somewhere. So far, this technology is very well researched. More than 38,000 peer-reviewed publications are credited on Da Vinci technology.
A surgeon who's got trained for doing robotic-assisted procedures in an area or in a field very few have ventured from India today. The milestone is that we have managed to get the first patient who has benefited from this technology from the state of Karnataka, which also puts us on the global map. When we started this journey about early this year in 2024, we were trying to understand what are the challenges that clinicians and patients go through. One of them we realized is to take the step forward in the battle against cancer. If you look at the 3 clinical presentations made by Dr. Jayanti, you'll find one of them is 28 years old, the other one is 40 and the other one is 50. What it shows is that cancer is a great equalizer. It doesn't actually look at anybody from a caste, creed, religion, age, or social economic bearing. It could touch everyone. Two of them were fortunate to be screened early through the new innovative technology and program we have started, which is called the fastest and most precise breast cancer screening program, which makes sure that the patient gets the answers for all the questions that she has when it comes to her own breast health by the end of the day in 24 hours. What it brings about is the importance of awareness and screening, which is the first step. Very less is done in India. The battle against cancer is half won by taking the step forward, by actually getting people to come in for awareness and screening. While technology is a great enabler, to me, if everybody could take that step forward and actually understand their cancer quotient for coming forward to actually get screened, get diagnosed, and also understand how easier it could be, because as the adage goes, earlier you say you can nip it in the bud.
I'm Dr. Jayanti Tumsi. I work as a lead surgeon in the Department of Breast Oncology at Appolo Hospital, Bannerghatta Road. ಇವತ್ತು ನಾವು ಇದೊಂದು ಮೀಟಿಂಗ್ ಮಾಡಿರೋದು ಒಂದು ಹೊಸ ಟೆಕ್ನಿಕ್ ಫಾರ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಸರ್ಜರಿ, ಅದಕ್ಕೆ ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ನಿಪಲ್ ಸ್ಪೇರಿಂಗ್ ಮ್ಯಾಸ್ಟೆಕ್ಟಮಿ ಅಂತ ಹೇಳ್ತೀವಿ. ಇದರಲ್ಲಿ ಏನು ವಿಶೇಷ ಅಂದರೆ ಇಂಡಿಯಾನಲ್ಲಿ ನಮಗೆಲ್ರಿಗೂ ಗೊತ್ತಿರೋ ಹಾಗೆ ಇನ್ಸಿಡೆನ್ಸ್ ಆಫ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದೆ. ಆಮೇಲೆ ತುಂಬ ಯಂಗ್ ಆಗಿರೋ ಮಹಿಳೆಯರಿಗೆ ಇದರಿಂದ ಎಫೆಕ್ಟ್ ಆಗ್ತಾ ಇದೆ. ಅದೇ ಟೈಮಲ್ಲಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೂಡ ತುಂಬ ಅಡ್ವಾನ್ಸ್ಡ್ ಆಗಿರೋದ್ರಿಂದ ತುಂಬ ಪೇಷಂಟ್ಸ್ ಕ್ಯಾನ್ಸರ್ ಬಂದರೆ ಕೂಡ ಸರ್ವೈವ್ ಆಗ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಸರ್ವೈವ್ ಆದಮೇಲೆ ಅವ್ರಿಗೆ ಒಂದು ಗುಡ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಕೊಡೋದು ಕೂಡ ಅಷ್ಟೇ ಇಂಪಾರ್ಟೆಂಟ್. ಬರೀ ಕ್ಯಾನ್ಸರ್ ಕ್ಲಿಯರೆನ್ಸ್ ಅಲ್ಲ, ಗಿವಿಂಗ್ ಅ ಗುಡ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಕೂಡ ತುಂಬ ಫೋಕಸ್ ಇರಲೇಬೇಕು. ಅದನ್ನು ಮನಸ್ಸಲ್ಲಿ ಇಟ್ಕೊಂಡು ಅದನ್ನು ವಿತ್ ದ್ಯಾಟ್ ಇನ್ ದ ಥಾಟ್ ವಿ ಹ್ಯಾವ್ ಡನ್ ಅ ನ್ಯೂ ಪ್ರೊಸೀಜರ್ ವಿಚ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಸ್ ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ನಿಪಲ್ ಸ್ಪೇರಿಂಗ್ ಮ್ಯಾಸ್ಟೆಕ್ಟಮಿ. ಅಂದರೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರಲ್ಲಿ ಕೆಲವು ಸತಿ ಪೂರ್ತಿ ಬ್ರೆಸ್ಟ್ ತೆಗೆಯೋದು ನೆಸೆಸಿಟಿ ಆಗುತ್ತೆ. ನಾವು ಇದನ್ನು ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ಮಾಡಿ ಒಂದು ಸಣ್ಣ ಇನ್ಸಿಷನ್ ಅಂದರೆ ಕಟ್ ಮಾಡ್ತೀವಿ, ಸ್ಕಿನ್ನಲ್ಲಿ ತುಂಬ ಸಣ್ಣದಿರುತ್ತೆ, ಕಂಕಳ ಕೆಳಗಡೆ ಸಣ್ಣ ಕಟ್ ಮಾಡಿ ಅದರ ಥ್ರೂ ನಾವು ರೋಬೋಟಿಕ್ ಮೆಷಿನ್ ಯೂಸ್ ಮಾಡಿ ಬ್ರೆಸ್ಟ್ ತೆಗೆದಿದ್ದೀವಿ. ಅದರಲ್ಲಿ ಸ್ಕಿನ್, ನಿಪ್ಪಲ್, ಆಮೇಲೆ ಏರಿಯೋಲಾ ಯಾವ್ದು ಹೆಲ್ದಿಯಾಗಿದೆಯೋ ಪೇಷಂಟಿದ್ದು ಅದನ್ನು ಇಂಟ್ಯಾಕ್ಟಾಗಿ ಇಟ್ಟುಬಿಟ್ಟು ಒಳಗಡೆ ಬ್ರೆಸ್ಟ್ ಮಾತ್ರ ತೆಗೆದುಬಿಟ್ಟು ಅದರಲ್ಲಿ ನಾವು ಇಂಪ್ಲಾಂಟ್ ಹಾಕಿ ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಮಾಡಿದ್ದೀವಿ. ಈ ಸ್ಪೆಷಲ್ ಸರ್ಜರಿ, ಅಡ್ವಾನ್ಸ್ ಸರ್ಜರಿದು ಬೆನಿಫಿಟ್ ಏನಂದರೆ, ಒಂದಂದರೆ ಸ್ಕಾರ್ ತುಂಬ ಸಣ್ಣದಿರುತ್ತೆ, ಕಟ್ ತುಂಬ ಚಿಕ್ಕದು ಇರೋದ್ರಿಂದ ರಿಕವರಿ ಫಾಸ್ಟ್ ಆಗ್ತಾರೆ ಪೇಷಂಟ್. ವಿದಿನ್ 24 hours ನಾವು ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡ್ಬೋದು. ಬ್ಲಡ್ ಲಾಸ್ ಆಗಲಿ, ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್ ಆಗಲಿ ಇರೋದಿಲ್ಲ, ಪೇಯ್ನ್ ಕಡಿಮೆ ಇರುತ್ತೆ. ಅವರು ಕೂಡಲೇ ಅವ್ರ ಕೆಲಸಕ್ಕೆ ಜಾಯ್ನ್ ಆಗ್ಬೋದು. ಇವತ್ತು ಒಂದು ಪೇಷಂಟ್ ಅವ್ರ ಟೆಸ್ಟಿಮೋನಿ ಕೊಟ್ಟರು, ವಿದಿನ್ ಫ್ಯೂ ಡೇಸ್ ಅವರು ಕೆಲಸಕ್ಕೆ ಜಾಯ್ನ್ ಆಗ್ಬೋದು. ಆ್ಯಂಡ್ ಓವರ್ ಆಲ್ ಕಾಸ್ಮೆಟಿಕಲಿ ನೋಡಿದ್ರೆ ಪೇಷಂಟಿಗೆ ತುಂಬ ಸ್ಯಾಟಿಸ್ಫೈಯಿಂಗ್ ಇರುತ್ತೆ. ಥ್ಯಾಂಕ್ ಯು.